Our politics editor Sibungalwa at Luthuli House, as we will be taking you there in about 10 minutes or so as the Q&A with President Cyril Ramaphosa takes place. Now, Health Minister Dr. Zweli Mkhize announced earlier this week that the Serum Institute of India will send South Africa 1 million doses of AstraZeneca in January and 500,000 more in February. The doses will be given to healthcare workers first. To help unpack what this move means in the fight against COVID-19 in South Africa, I'm joined by Steve Litzike, the South African National AIDS Council Chairman. A very good morning time. You have made out a call urging the Health Minister to also ensure that he includes community healthcare workers in phase 1 of the vaccine rollout. Talk to us about why this is so important to you.
Thank you so much for the invitation, and good morning to your viewers. Indeed, we've made a call out immediately when the health minister announced, that South Africa has gotten a confirmation from Serum Institute of India that we'll get 1 million dosage for January and 500,000 dosages for February. And for us, it was quite important to make that call that healthcare workers must never be divided in any way. Public, private, those in civil society movement, and the traditional health workers. I must confirm to you, with the framework and the strategy that was shared by government yesterday, it now confirms that the health workers will be included. Right now, I think for us as civil society forum and as also as community constituency front, what we are wanting to see is a strategy in which way, how this will be administered, particularly the civil society organizations that are driving the services in communities, because they have been doing it for years, responding to HIV pandemic, responding to TB, STI, and many other illnesses in the communities. For us, we do not want to see any division. We want to see a united health workforce that responds to COVID.
Community health workers, talk to us about their role and the importance of them getting this vaccine and ensuring that they are indeed, prioritized.
See, the most important thing is that, we understand exactly why there's a need for communities' role, particularly around prevention, but as well as a vaccine diagnostic and treatment that is often given in a clinical aspect. But for us, our experiences with HIV, with TB, and many other illnesses, community health workers have served to be the bridge between health system and communities, particularly putting a community system in place, responding to realities of families, of households, supporting the treatment, supporting the care and support within the community system, but also informing communities of facts and really debunking the myth that we've been seeing, and particularly what we've seen with community health workers having been absorbed in many other provinces, but others who are primarily within the community-based organizations. What we've seen even with the current work that we've been doing as community constituency front, we have put community measures in place, working with agents, and these are community workers that have been going across the country, informing communities about the campaigns that we've led from day one, actually, of COVID in South Africa. We have led a campaign that was titled, I Am, You Are, We Are Together in Ending COVID-19. We work with civil society sectors, with diverse communities, traditional leaders, women, you name all 18 sectors, and NEDLEC community constituency front with community agents, particularly driving a change, whether in taxis, whether in different settings, particularly to ride on thinking twice and really responding to community measures.
You mentioned one concern is that how this process will be administered. What are some of your other challenges and concerns as as we all wait for this vaccine?
Part of it is it is really around the efficiency of of the vaccines themselves, the state of readiness and the capacity of our country in really managing this big task. Indeed, the President, the National Council have alluded to the big task that government has to administer this. The partnership that we've seen over time between government and civil society really have, between government and private sector, have slowly integrated community measures in place. If we should have integrated this from the first set as part of the response, we shouldn't be where we are, where we're seeing the spike of new infections. And I mean, particularly what we have warned the government around. But some of the concern that we have is really about the phase approach, in which we know as a whole country, we need about 30 billion to actually administer vaccine for all population in South Africa. But whether we will do it in the right timeline that have been stipulated is a big question. Whether or not the vaccine that is coming up will be administered in the right time, distributed equitably in provinces, in facilities. Our health system already is under pressure, in severe pressure that we are alluding to. Some of the concerns that we've raised was also around the regulatory impediments that really must never be delayed. We want vaccination to be accessible to people. Yes, we welcomed what the minister have called the phased approach, and we are actually happy to see this phased approach, but we want it to be timely, we want it to be met. Last point that we have as a big concern as civil society, experience have taught us. We've seen with ARVs going missing, being stolen by healthcare workers in provinces like Free State and others. But this has been the biggest concern, that are we sure the security of these vaccines will be in place? We do not want this very important commodity to go missing because it is coming in drips. It's not coming for all population at the time. But also what we are saying is that even in the light of a phased approach, government must ensure that a community approach, a community informed information that goes into literacy of vaccination, educating communities is in place. Absolutely. By partnering with us and by ensuring that everywhere in communities, we do not neglect education to ensure social and behavior change.
Thank you so much for your time. Unfortunately, I'm going to have to cut you short there. I do apologize for that. Appreciating your time and your insight there. Steve Litsika there, who is from SANEC, calling, of course, for some of the concerns raising the inclusion of community health workers in the phase 1 of the vaccine rollout, of course, saying that that process is now underway, and just giving us a sense of some of the concerns ahead of that vaccine.